The patient knew he wasn't supposed to feel any pain when he went to have his kidney stones surgically removed.
But he did, and he told authorities the pain was so severe it felt like long needles going through his skin and into his kidney. And now he knows why he felt that pain. Today, prosecutors charged a nurse with stealing the pain medication meant for her patient. We get more from Carol Evans' Carla Holt.
The complaint reads like a horror novel set in a hospital. Last November, the alleged victim went to Abbott Northwestern Hospital to have his kidney stones removed. The procedure wasn't an easy one. It involved inserting a tube into the patient's back and down into his kidneys, and it required the use of heavy pain medication. But minutes before the surgery began, the complaint says 33-year-old Sarah Casaretto, the nurse in charge of doling out that pain medication, offered the patient a cryptic warning.
And she popped this guy on the table and said, "You got to man up."
According to the complaint, Casaretto specifically said, quote, "You're going to have to man up here and take some of the pain because we can't give you a lot of medication." What followed next, authorities say, was pure pain for the patient. The patient described the feeling as very long needles going through my skin and down into my kidney. Authorities allege Casaretto took the 500 micrograms of fentanyl intended for the patient and wasted more than half of it. They say she gave the patient less than a third of what he needed before keeping the rest for herself. And that, authorities say, is what separates this case from all others involving the theft of pain medication.
This is the first one in my experience when the guy's actually on the table, needing 500, and he gets 150. That's probably what makes this, more egregious, at least in my book.
Other hospital workers did report the nurse seemed out of it, kept falling asleep, and even appeared intoxicated. At one point, another worker said Casaretto told the screaming and moaning patient, "Go to your beach, go to your happy place."
We did go to Sarah Casaretto's home in Forest Lake tonight, but we're not able to reach her. She is no longer working at Abbott Northwestern. She resigned from her position when asked to submit to a drug test. The hospital says they cannot comment on a case involving a former employee. The Minnesota Board of Nursing told me tonight that while cases involving drug theft do happen, the board would take this one very seriously. And we also heard, Mike, a little bit about how people are sympathetic to the fact that she has a terrible drug addiction, but that clearly in this case authorities say that is no excuse.
Yeah, to say the very least. All right, Carla, thanks.